discussion about the sliding scale also, how exactly we do increase or reduce the sugar, the insulin infusion. We dilute 50 unit of insulin in 50 ml of normal saline and we infuse the rate per hour of the insulin as per the glucose level. Now, one of the most important case history we can understand, and today, before we enter into any other treatment, we have the next part is treatment of non-ketotic hyperglycemia, which is also called as the hyperosmolar non-ketotic coma, HONC commonly it is called as. It is a non-ketotic hyperglycemia. That means in this case, there will be no ketosis. But before we go into any important next topic, we need to understand about one of the more important case history. Now this history is a practical management of, I can say, a type 1 diabetes mellitus, where the patient who was about, let's say, young patient, 17 years old, was admitted in the hospital with diabetic ketoacidosis. Her, in the initial workup of her pH level and the blood sugar level, the pH was about 7.19, so it is an acidic, obviously because of more and more ketosis. The ketone bodies which are produced are more acidic in nature, and that gives rise to all those acid in the blood circulation. Her blood glucose was also very high, about 1200 milligram percent, more than 1000 milligram percent, 26 millimoles, or I can say more than that. Now, when the patient was admitted, as we discussed in the treatment of diabetic ketoacidosis, that we gave what? We gave, in the treatment part, we gave active rehydration. Normal saline is supposed to be infused, as we discussed in the last lecture about. And we gave intravenous insulin as per the sliding scale. So active rehydration and intravenous insulin brought her blood glucose level to below 400 milligram percent. That means the treatment has responded. The pH was also about 7.3. That means pH has increased, blood sugar has fallen. That is what we want as a treatment. So initially, we thought that the patient is responding, satisfied with the fall in glucose level. Glucose level has fallen. So now, as per the sliding scale, the treating doctor, who might be a junior doctor, reduced the insulin infusion. So what he did was right. Reduce the insulin infusion to, let's say, as per the sliding scale, 2 units per hour. Initially it was high, so we gave more insulin. So now it is reduced according to the sliding scale, and continued the normal saline, because normal saline is supposed to be continued for minimum 24 to 36 hours. So logically the patient was being treated properly according to the sliding scale. The 2 units per hour for the insulin was given and continued with isotonic normal saline, and also was given with potassium supplementation, because hypokalemia can further reduce the problem. So up to now the patient was treated well. Okay. Up to now the patient is properly getting treated. 4 hours later, patient was found to be tachypneic, flushed. When repeated the blood investigation, pH was 7.1, again becoming more acidic. See, understand, reduced insulin infusion was normal according to the sliding scale, because the blood sugar was less than 9 millimoles, or I can say less than 400 milligram percent, approximately 400 milligram percent. But this reduced infusion, because otherwise the patient would have landed into hypoglycemia, which would have been more dangerous. But this is not enough to reduce the ketone body production. That means this particular patient, even if the blood glucose was responding as per the sliding scale, the ketone production or ketone bodies production rather was continuously more. So we could not stop the ketone body production, but not sufficient to halt the ketone body production. So according to the acute stages of diabetic ketoacidosis, remember what is an important note. Let me write down with a different color here. What is an important note? After blood glucose level falls below 9 millimoles per liter, it is advisable to reduce the insulin infusion as per the sliding scale, but also it is important to infuse 10% dextrose or 5% dextrose. 10%, 5% dextrose after the blood glucose level falls below 10 millimoles per liter, and 10% glucose when it falls below 8 millimoles per liter, because this is important to reduce production of ketone bodies. Otherwise, patient can land up with repeated pH is going to be increased. Patient will going to land up with ketoacidosis, further ketoacidosis. So ketone bodies can also be easily measured with the help of a finger prick test, which is very important to manage the patient properly. Which is very important to manage the patient properly. So this is one of the important, I can say, case history I want to give you an idea about before we enter into any